I'm really, really sad that we're having to go and move forwards with industrial action. And I think it's evidence of how far this government has pushed us. And it's evidence that as doctors, we really are standing up for our patients and saying that we cannot and we will not accept a contract that is going to have hugely adverse long-term consequences for our patients that we have vowed to care for.
Nobody wants to go on strike, and yet 98% of junior doctors have agreed that this is the right thing to do because it's got to that stage of necessity.
Anyone really goes on strike very reluctantly. It's the final measure when all other options have been exhausted, essentially. And what we've seen is a government that, despite its public statements, is not really willing to compromise and, in fact, wants to impose this contract against the wishes of junior doctors and many others in the NHS who are supporting them.
Jeremy Hunt has been very unclear as to what sort of 7-day NHS does he actually want, and he's also completely ignored the fact that medicine is a team game. Doctors work with nurses, they work with other healthcare professionals, social care, and so forth, and there's absolutely no money yet to fund for more of those.
Instead of trying to spread 5 days worth of general doctors over 7 days when they're already stretched, what they need to do is invest in more doctors and more nurses and more physiotherapists and more social care workers, so that actually you can have a 7-day NHS, but you cannot have a 7-day elective NHS when you're not providing the money for it. It's ridiculous.
I've worked as a doctor in the NHS for 11 years. I've experienced staffing shortages, doctor shortages and nursing shortages, and it is dangerous. These new contracts, which we do not agree with, are going to force doctors to make the choice between staying and working in a contract that they don't agree is safe or leaving the NHS.
The NHS is already on its knees with the current services. To make us work longer, we will end up making mistakes. We will put people at harm. We will not let that happen. We cannot let that happen.
You know, the bigger picture is that every single one of us will be a patient. Every single one of us has invested in the NHS and wants to see it continue. So we just need to work together. It's not about who wins on this, because ultimately, if we're stuck in this deadlock continually, it's the patients that lose out.